Um, Good afternoon, everyone. My name is Mboloi. I work in Makueni County. Kenya has aimed at eliminating rabies by 2030. And in the strategy, a few counties were selected to pilot on this project. And Makueni, where I work, is one of the counties that was selected to pilot on this project. So, rabies is a viral zoonotic disease. I don't think I need to mention a lot of that. That is very well known. And the photo on the right shows how the virus actually moves. Makueni County has been implementing the program on elimination of rabies in humans by the year 2030 since 2014. This has been through guidance of strategic plan, which was developed by ZDU. The Kenya Rabies Elimination Strategy was adopted in 2014 and launched actually in our county, Makueni, the same year. The objective of the strategy to eliminate dog-transmitted human rabies, again by 2020, the strategy highlighted on 4 pillars. 1, mass dog vaccination. 2, timely provision of PrEP and PEP, and then strengthening surveillance for rabies cases and response to outbreaks. And then the public health education and awareness on rabies. Now, there are 6 stages in the approach. 1 is rabies suspected to be present, but limited information is available. We have really limited data in the country. Then development and adoption of the National Rabies Elimination Strategy, and then implementation of the National Rabies Elimination in pilot, and that's what I'm reporting on in my county. Then rabies risk reduction through full-scale implementation. So once we get the results of the pilot, then you'll be able to upscale to the rest of the country. And then there's maintenance of freedom from mediated human rabies and canine rabies. Then declaration of freedom from canine rabies. So those are the counties that were 6 of them were selected. So I'm reporting on Makueni. All the selected for having high burden of rabies. In addition, the choice of Kisumu and Siaya allows for testing the contribution of natural barriers. Siaya and Kisumu are in the western part of Kenya. There's a lake, and then there's the Rift Valley in between. That is the location of Makueni, the colored. And the bigger picture is there. That's the county. The county is divided into 6 sub-counties as shown with the borders. It's in the southeastern region of Kenya. The objective of the pilot program is to demonstrate success before scaling up to the rest of the country and potentially Africa. Now, I want to report on achievements based on what we've seen as implementers, as government, together with our stakeholders. So initially we didn't have a dog population number, and we did an initial census, and we got about 125,000 dogs in the county. And then from this, the dog vaccination sites were established. Now, we started the vaccinations from 2014 during the launch, and a total of 256,001 dogs have been vaccinated in the county so far. And that is the breakdown of the vaccinations over the years. So a small number during the launch, 5,000, and in 2018, last year, we did 74,726. Look at the percentages. Our goal is actually to get to 70%, but if you look at it, we've not been able to attain the 70% target in any of the last 4 years. The entire process involves holding planning meetings with the sub-county vet officers, and then holding a meeting with the ward. Our operating unit is what we call a ward, and Makueni has got 30 of these wards. And these wards are within the 6 sub-counties. So we've got staff who are based at different levels, from the ward to the sub-county and then the county level.
Then there's establishment of a program for the vaccination for the various teams. So the teams of the various regions were established at those levels. Then before we do publicity 1 week to the event through distribution of posters to schools and churches, involve the chiefs, the local chiefs and assistant chiefs, as well as other local administrators. We've got a platform in Makueni that we use with the local service provider called Safaricom, and we've got a database of most of the households within Makueni. So we pass information through that platform. The publicity is crowned up with a mobile publicity the day before, and you can see that small car there with a speaker on top. You go around announcing the vaccination day. Then would hold a vaccinators meeting, and this involved both private and government collaborators. Then we would carry out vaccinations as programmed in the morning and in the afternoon sites. During vaccination, supervisory teams from the county and sub-county would actually be involved, and that photo shows some of the staff from the county and our collaborators. Then B is dog population management. An initial number of teachers, 2 per ward, were trained, and each became a champion. Then these teachers would train other teachers, 3 at least, and in the county we had a total of 180 teachers trained. Then these teachers would train students in their respective schools, including in churches about dog management, including responsible dog ownership during school events where possible. Then prevention of rabies in humans. This was done by providing timely access to appropriate post-exposure treatment, and then for surveillance of dog bites in humans, and then recording of all bite cases reported and treated. And you can see the form on the right. By increasing knowledge and skills among human health workers in hospitals. So we collaborated with the Department of Health. And these are some of the numbers, especially the human PEPs. You can see from reports from 2 main referral hospitals, the number of bites that were reported, and the compliance to PEP. You can see the decline from the first one towards the 5th one, where we have only 37% as average, and while the first dose and the second, you get 100%. Then strengthen surveillance and response to outbreaks, community-based surveillance. We had a toll-free number, which is shown on that poster there. So dog bite cases reported at the 2 health facilities, alerts through the toll-free number, and case alerts from the community. Total number of cases reported were 636 cases of human bites, 44 animals were bitten, and we had 536 biting animals. That is, if you can see that, the lip, you can see that's a kid that was bitten, dog bite. And you can see another case on the cheek, that school child was bitten. Most of the animal bites were actually dog bites. The bar on the left is actually the dogs and the rest of the animals. Follow up on biting animals, PEP administration to victims. Of the 636 contracting tracing done, 359 bites patients were reached on follow-up. 15 human bites bitten by positive dogs, and 2 humans bitten by positive cats. 63% of the bite patients did not complete PEP, as I had shown earlier in the table. Now, the different species of animals that caused bites, you can see dogs, 19 of them, and down even ovine, caprine, equine, bovine, etc. Those who are tested, 32% was found to be positive, and only 5 were actually negative. So again, dogs were the biggest causes of rabies. Now, we even went for a benchmarking. I saw somebody from Philippines, that is Philippines, together with the colleagues who are here. We visited hospitals to learn how Philippines control rabies, and that's a field in Philippines, again, Manila. Again, in Manila there.
Conducting and promote operational research, we are 2 MSc students attached to this program. And then advocacy, communication, and social mobilization. There is considerable success in mobilizing the community to provide their dogs for vaccinations, as you can see on the pictures on the right. Then enhanced partnership and collaboration. We've collaborated with Wild Animal Protection, ZDU, CDC, DVS, Washington State University, Cambridge, and Global Alliance for Rabies Control. The county has set up coordination committees at the county and sub-county levels. The committees are meant to review the ongoing rabies elimination. From Monday, we are actually now going to have, together with World Animal Protection, we are going to do an evaluation study on the entire program, starting this Monday. Resource mobilization, we wish we could get more, but those are the collaborators. Challenges, delayed sample submission for laboratory diagnosis, lack of proper surveillance, poor intersectoral collaboration and partnerships, which I've heard from most of the speakers. There's low awareness on rabies prevention and control measures, inadequate policies on dog management. Then there's low adoption of responsible dog ownership despite the training that, awareness that we've created, inability to continuously track information on dog vaccination, inadequate enforcement of existing laws, program sustainability beyond the donor funding period, possibility of transborder transmission because, you know, the neighboring counties do not actually, have not adopted this program. Then compliance to PEP. A bit of discussion, Makueni has reliable dog population census, as I've shown. Then PEP, which is one of the challenges in most of the cases. We've got what we call universal health care, and all registered households are actually able to receive free PEP. And kids who are below 5 years and adults above 65 years, they do not have to register. They will have access to PEP free of charge. No human case reported since inception. There is great collaboration with Department of Health and future collaboration with urban planning and environment departments on food waste management that is going to come. From the learnings of the pilot, it seems to be capable to upscale to nationwide. There should be adequate funding wherever possible, and we encourage counties actually to allocate funding in their budgets. Then change of attitude towards dog responsible ownership should be enhanced. Awareness of rabies and the management is important in its control. Sufficient availability and affordable PEP for those exposed. Those are collaborators. And then vaccinate your dog and save life wherever you can. Thank you very much.